I got interested in this topic of healthcare, working in the emergency department for almost 40 years at Denver Health and at Swedish and at Lutheran as well. And after about 10 years, I realized there was this issue. Every time I worked at Denver Health, particularly, and the other hospitals, I'd encounter patients who were seriously injured or ill. And they would say, gosh, I don't have health insurance. How much is this going to cost me? And most of them were working. And I'm saying, what is going on in this country, the richest in the world? And we got people who have no health insurance. And so I started giving these talks about 30 years ago now. And it's evolved. I've done many talks here in the other chapel for the Auctioner Ollie group. I have an 8-hour course that I've been doing on how healthy is our healthcare, why does it cost so much, and why you should get your appendectomy in La Junta. I'll tell you about that in a little bit. So, we don't have a healthcare system, we have a healthcare marketplace, and that's the problem, one of the big problems. And the other problem is greed. There's so much money in the healthcare system, $4.3 trillion last year was spent, and everybody wants to get a part of the piece of that action, and they're neglecting patients who really need the care. So we're going to focus on 2 hours of the 8-hour talk that I had usually have given on waste, fraud, and abuse in healthcare. And so who pays for the $4.9 trillion our country spent on healthcare in 2023 is where these statistics are from. Well, surprisingly, 70% is funded by tax dollars, either directly or indirectly. Indirectly by tax deductions, directly by premiums and subsidies. Subsidies for Obamacare, and of course, subsidies for Medicaid, and indirectly by people who can take tax deductions for their health care payments. We spent over $1 billion for Medicare, almost $900 billion, and these numbers, of course, have gone up in the last year. On Medicaid is over $900 billion now. Private health insurance, where half of the people in our country get their health insurance through a private employer. And that's, those premiums, incidentally, for a family of 4 are now at $25,000 a year. Most people don't realize it because the employer is picking up most of it, but they've gotten hit with increased co-pays for their premiums. Out-of-pocket spending, and that's a big problem here, which is the reason why over 500,000 people a year in our country have declared medical bankruptcy because they can't pay their bills. And the bills are just incredible. The VA is up to $200 billion a year. Other health programs, such as the US military, the Public Health Service, the NIH, and of course, correctional care. The only group of people in our country guaranteed health care under the Constitution are who? Prisoners. Because to deny them health care would be cruel and unusual punishment, although they don't always get the best health care, but they do get it in jail. This is the breakdown. Private dollars, 35%, and you can see the breakdown for where the taxpayer dollars are spent, and that's a huge amount of our expenditures. Yet we spend twice as much, over $12,000 up to $13,000 a year now per capita. The world average is about $6,000. So we're spending twice as much as most other countries on health care, and they insure everybody. And nobody goes goes bankrupt because they can't pay a bill in those countries. But we're unique. We're special. Here is just a breakdown to show you how much more we spend on administrative costs compared to other countries. And that's part of the waste we're going to talk about and some of the abuse. So that's the background. That comes from my 2-hour talk on Let's Follow the Money, okay? And that is pretty, I think, enlightening for a lot of people. So what's the root cause of our healthcare dilemma? It's the exorbitantly high cost of our healthcare in our country. And we still have 10% of the population, over 30 million people, who have no insurance whatsoever. That's going up now that they're cutting Medicaid for people in many states, including Colorado. 50 million more are underinsured. That means they can't even afford the copays and deductibles as part of their insurance. That's underinsurance. We have poor outcome measures compared to the rest of the world. In fact, they're terrible. For all the money we spend, we have both the best and the worst health care. We got the best if you're in the right place at the right time or you have money. If you get major trauma in Denver, when I was there for 32 years, our survival rate, we got you to the ER with any vital signs, 95% of people survived. Bankruptcy. Here's an interesting slide. If you look at the bottom two lines, the gray dotted line is inflation. The green line is earnings. Now, they've gone up a little bit since 2020. But then the blue line is premiums. You can see premiums rise far faster than wages. Employers keep trying to keep up with the premiums, and they can't pay any other benefits because health insurance sucks up so much money. And then, of course, the deductibles. That's the way insurance companies make it affordable. They just increase your deductibles. What is waste? Well, that's obvious. It's the misuse or overuse of resources, resulting in unnecessary cost. Examples: unnecessary tests and procedures, too many hospitals with a lot of unfilled beds. Look at Southeast Denver metro area. They've got 3 or 4 hospitals in a very close proximity to each other. They've got whole floors in some of those hospitals that aren't even occupied yet. There's not enough patients, and that's a huge expense. Too many freestanding ERs and medical helicopters. At one point in time, Colorado had over 30 freestanding emergency departments. Huge waste. Duplication of expensive technology. We have all kinds of expensive technology everywhere. In other countries, they use that technology 24 hours a day. Here, sometimes it's just 5 days a week. Too many, this one gets me. Well, I'll show you some numbers on what hospital administrators and pharmaceutical CEOs and everybody else pay themselves. The medical industrial complex, which is lobbying, we'll get into that, and private medical insurance overhead, which is around 20% compared to 2% for original or traditional Medicare. Examples of waste: hospital overhead and profit. 25% of hospital budget goes to that. That's twice as high as other countries. The private medical insurance overhead and profit compared to 3%, 2 or 3% for Medicare. Medicare Advantage subsidies, which are over 17% now. And that's a whole nother talk on how Medicare Advantage is funded. They're ripping the taxpayer and Medicare off. Excuse me, Obamacare, huge administrative overhead, and the tests and procedures, billing and collecting. We're going to get into all this. How can we reduce waste in our healthcare system? Some reviews. That's up to $1 trillion a year. The Institute of Medicine many years ago put it at 750 billion. Now it's at least $1 trillion. $1 trillion. 34% of the 4.3 trillion that we spend goes to the cost of administrations. That's to insurance company administration, hospital billing and debts, physician offices. I'll show you the numbers on what administration is costing us, where in places with a single payer, that goes down, way down. In Canada, I have friends working in emergency departments, and I said to them, how much does it cost you guys to do your billing? They said, $2 a patient. I said, what? They said, $2. Yeah, we just have a billing clerk who takes the information, sends it off to the provincial office. And I said, how soon do you get paid? They said 2 to 4 weeks. I said, what's your collection rate? They said 98%. Now that's efficiency compared to here. Administrative expenses. This is an interesting comparison. In 1998, Taiwan said, our healthcare system is not very good. We need to do something about it. They hired 2 people out of Boston and Harvard to come over to Taiwan and do a consult and tell them, suggest to them a system which is patterned on our original Medicare and the Canadian Medicare. Within a year, because they had the political will to do it, Taiwan instituted the system, and their administrative overhead is 1.6%, and they insure everybody. Private insurer waste, this is huge. Claims processing with the goal of minimizing patients. In other words, denying payments or denying approval for pre-existing, to get approval to do things. Tests, surgery, whatever the patient needs, they often deny it. Negotiating discounts with doctors and hospitals, that takes a huge amount of money. Marketing, you all see this on television. We should not allow marketing of hospitals, of practices, and particularly of pharmaceuticals. It's a huge waste, and it contributes to all kinds of problems. Lobbying, huge salaries, and this is the bottom line. This is the whole deal for private medical insurance. Their whole goal is to make a profit, not to provide the best quality care for the patient necessarily, but to make a profit. Before Obamacare, they did it by selecting out insuring the healthy and avoiding the sick. Now with Obamacare, if you're under that, they can't deny you for pre-existing conditions, but they can make it difficult for you to get care if you're really sick and encourage you to go, if you're eligible, go to original Medicare or go somewhere else. Going on here. Okay. It would be cheaper to cover everybody under Medicaid, which is the blue line, than it is for the subsidies of private health insurance, which is the gray line. We spend $800 billion a year just filing paperwork. 12 million hours on the phone every week. Patients, providers, insurance companies, back and forth, trying to straighten out billing. What a waste of time for a physician or a nurse's time to have to spend all this time trying to deal with insurance billing, where they could be caring for patients. This slide says it all. This is published in JAMA, came from Duke. They have a 1,000-bed hospital, and they have 1,600 billing clerks. It's a comparable size hospital in Canada at the University of Toronto. They have 7 billing clerks. Look at all the money that's wasted just in that shuffle of billing. Now, they're going after waste, fraud, and abuse. You know, Elon. Elon's going, he's going after the cheaters, for the people who are cheating Medicaid, who shouldn't be on it. Here's where he needs to go. But why won't they touch this? Because it's private, it's the corporations. It's the law. They have all the money for lobbying. They don't want to touch the people who are making all the money and wasting all of our money. Here's the, the difference in overhead between Medicare. Medicare Advantage is neither an advantage nor Medicare. It should be Medicare Disadvantage, and it's private insurance is all it is. It's not Medicare at all. And a huge, huge overhead here. Yeah, well, I'll talk a little more about it as we go along. Well, let me just tell you how Medicare Advantage is funded. The private insurers said, we want to get involved and take care of Medicare patients. And so they negotiated with Congress and CMS and whoever else to do this thing called Medicare. They called it Medicare Advantage. It's Part C Medicare. And the way it works is the Medicare says, okay, for a given geographical area, for example, Denver, we'll pay you what we have paid out on average per patient in that time. So right now in Colorado, it's over $1,000 per month for Medicare Advantage patients that Medicare transfers the funds to the private insurance company, whether the patient needs Medicare or not. It's a capitated amount. But the private insurer said, hey, but what happens when we have sick people? It's going to cost us a lot more, and we need more money. And guess what? Medicare said, yeah, we'll transfer more money for you. And we're going to get into the scam that's going on over that. So, fraud. This one give you chest pain. Examples. Medicare Advantage risk adjustment. I'll go into this. This is a huge area of fraud. Well over $80 billion a year in this bucket alone. Medicare Advantage fraud. Hospital and provider insurance billing. The fraud here is upcoding. We have diagnostic codes. There's usually 5 levels. And they figure out ways to increase the level, which then increases the reimbursement, even though the level wasn't right. It wasn't correct. And I've seen that game played all the time by hospitals and ERs. Prescription drug marketing and off-label prescribing, which results in fraud. Off-label prescribing means the drug, a psychiatric drug, approved to treat psychosis and bipolar disorder. Well, that's a large but a limited population. And then they say, oh, but you know, we got a lot of patients in nursing homes that can get disruptive and need sedation, and these drugs work really good for them. And they train their salespeople to go out and market it as off-label marketing for other uses. And they make billions of dollars on this. And then they get caught and they pay a settlement. They admit no guilt of any kind whatsoever. And guess how many people go to jail? 0. Kickbacks to providers. That's very common. DaVita is one of the major offenders here, and they're out of Denver with kidney dialysis centers. Hospice and home health care scams. Oh. They bill for home health care that is never provided because they get Medicare numbers and people will just bill under these numbers. Hospice, they're admitting people to hospice who get discharged from hospice after the Medicare runs out in 6 months. The idea is most people get admitted to hospice and don't leave. But they got any kind of insurance, let's bilk all the insurance, and then the patients sometimes didn't need to be in hospice. Same thing with addiction treatment. I mean, that's big, and they have poor scams just like hospice there. Medical equipment overcharges, or the favorite one is billing for all kinds of medical equipment that the patients don't need or never get. Have you ever gotten phone calls about, do you have any back pain or knee pain? and they want to get you a brace that then they will bill Medicare for. You never see a doctor. Do it over the phone. Hospital billing. Well, this is the landmark case was in 2003 when Columbia, which is now HCA, they have 5 hospitals in the Denver metro area. They were called Columbia back then, paid a fine of $1.7 billion for a criminal guilty plea of upcoding. That was big money back then. It's kind of average money now. How many went to jail? Of course, 0. Who was the CEO of Columbia? Does anybody know? Recognize this guy? Rick Scott was the CEO of Columbia Healthcare, and his deposition, he took the Fifth Amendment 75 times, and he claimed, well, I didn't know that people were doing this. I'm just a CEO, you know? So of course, there's no penalty for him. So he goes on to become governor of Florida, and he denies Medicare expansion to 1 million people in Florida. And the federal government was going to be paying 100% of the expanded Medicaid, and he denied it. And now, of course, he's a senator. Persecution is the big name that Trump put in place recently. So he's latched onto that, and he said he was persecuted over this Medicare fraud. Yeah, right. The truth about Medicare Advantage, it's neither Medicare nor an Advantage. United Healthcare is the big player in Medicare Advantage, and they play this game of, we'll get into it in a minute. But anyway, here is the 10 biggest providers of Medicare Advantage, and you can see how many were accused of fraud by a whistleblower, how many were accused by the federal government, Justice Department, and how many overbilled according to the Inspector General. Kaiser was left off this slide, but they since are on there because the feds sued Kaiser about a year ago in California for upcoding and Medicare fraud. UC Health just a few months ago paid a $23 million settlement over false billing accusations. So it's happening everywhere. DaVita, this was their 3rd settlement. Before that, they paid $100 million to settle 2 other cases some years ago of basically fraud. Now, how do health and private insurers exploit Medicare for billions? Well, they play this game of overbilling taxpayers annually. And the tactics is to take Medicare Advantage patients and make them look sick on paper. How does this work? Well, the insurance, in fact, when I retired, I got a call from a private insurer. They wanted me to go work for them and do house calls. I said, what do you mean? They said, oh, you don't really have to examine the patient. You just need to go out to our new patients, visit them in their home, and fill out a questionnaire. Okay? And that's what this is. They send now they're sending nurses out to fill out the questionnaires. And the questions go like this. 65 just goes on Medicare. Do you have any joint pain? How many people are 65 and have no joint pain? Okay, so you check that. And of course, joint pain, they don't need any treatment. It's not severe arthritis or anything. But the insurance company codes it as arthritis, and that ups their reimbursement. And they do it with all kinds of diagnoses. Many of them, the patient isn't getting any treatment for. But because they have this disease or diagnosis, they get paid more from Medicare. No treatments offered, the extra diagnosis, upcode. This was some years ago in 2014, adding greater than $3 billion a year. Now it's up to $70, $80 billion a year. And efforts to stop this were scrapped after industry lobbying blitz a couple years ago. A 1-hour nurse visit that led to insurers to collect $15 billion more from Medicare. That's what I just talked about. Insurers pocketed $50 billion from Medicare for no diseases that were treated. They just put this stuff on paper. Pharmaceutical company fraud. This is a big one. It's rampant and outrageous. It's simply viewed from them as the cost of doing business. Off-label marketing I talked about is the most common one. Puts patient at significant risk when you start prescribing and giving drugs that were not approved for those conditions. That sometimes isn't a good thing to do. No one goes to jail. Here's the settlements that they're into billions of dollars. Purdue Pharma, this is the OxyContin-Sackler family group. They paid $9 billion over this period of time. And the Eli Lilly was the poor one there. They only paid $1.6 billion. These are fraud settlements. Nobody goes to jail. Nobody is officially guilty of anything, but they just hand over this money. The government, it's a Justice Department suit. It goes back to the government. But those payments are a small amount of money compared to the billions they've made by fraudulent billing or fraudulent marketing. Now, here's the next one. Abuse. This is not illegal. They do it because they can. It's pervasive. It's usually unjustifiable charges for prescription drugs and medical devices, for clinic visits and hospitalizations, provider fees, health insurance and administrative excessive overhead and salaries, and a rampant abuse of the drug patent laws, where you can extend your 13-year or 14-year patent by taking the same medicine and making it an extended release capsule. You get a renewed patent. So you're the only company with this drug, so you charge whatever you darn well please. The middlemen is where the money's going, being sucked up big time these days. Who are these middlemen? Well, the private health insurance company is a middleman. They're between you and the provider. For-profit hospitals, they're on the stock exchange. They've got shareholders they need to get a profit for. Pharmacy benefit managers. This is very complicated and very difficult to understand, but they're in the middle between the companies that make the drugs and the providers or the pharmacists or the hospitals who get the drugs to the patients. And they suck up all kinds of money. And this is the biggest one right now. It's private equity investors. I call them vulture capitalists. These are companies that are buying up 70 or 80% of doctors now don't have their own private practice. They either work as a hospital employee, which I was a hospital employee, that worked out okay, or they work for a private equity company who's taken over the practice. Most of the private ERs in the Denver area now function under a private equity management company. And these are companies whose goal is to make a profit, who control the billing and the collecting and the coding. And the attractiveness for the doctors are, we don't have to worry about doing any billing anymore. But it's not working out real well. The way hospitals have, over the last 10, 15 years, is they started charging everybody what's called a facility fee. They've always charged a facility fee for the emergency department. The rationale was we have to have full staff 24 hours a day. And that costs extra money. And so people who get care in the emergency department, besides getting a bill for the care, they would attach a facility fee. Well, the hospital said, hey, you know, why don't we start doing this a little more? So I'll get back to that in a minute. The Nurses United, some years ago, I haven't checked to see if they've done it recently, went to see, they did what's called the charge to cost ratio. What the hospital charged a patient to what it really cost, and that cost was based on Medicare fee schedules. You can see it's 7 to 1, 700% markups, all the way down to 500%. And what's unique about this slide? Virtually every 4 or 5, almost all the for-profit hospitals in Denver are at the top of this list. A way to make a profit, huh? We're going to get into hospital charges here. So you can go to the Colorado Hospital Association website. I didn't do it real recently, but these charges are even much higher now. This is for an uncomplicated laparoscopic appendectomy, and this is the hospital charge. What is that? Well, the patient comes to the ER, we make a diagnosis of appendicitis, call the surgeon. He said, yeah, I'll come in and operate on him. The operation is 1 or 2 little incisions. Scope is put in, find the appendix, they cut it, tie it off, take it out. The patient goes home, usually within 16, 24 hours. So they go to the operating room. This doesn't include the anesthesia or the surgeon's bill. This is the hospital charge for that procedure. And look at the numbers here. All of those in dark at the bottom, the high charges, are again for-profit hospitals. So you have this young guy who says, I don't need health insurance, I'm healthy. And he wanders into Skyridge because he now has abdominal pain that won't go away. He has appendicitis, he has no insurance. That's the hospital bill. How do they get away with this? Because they can. There's no controls on what a hospital can charge for anything. Here's a patient who had a knee replacement by Kaiser and went to the OR in St. Joe's Hospital. The day he came in, stayed overnight on a ward and went home the next morning. And the hospital bill was $70,000. It's just crazy. Some of these, you get a sense for this therapeutic activity, 15 minutes. The nurse gets the patient out of bed and says, well, you got to walk now with this knee replacement. We got to get you up. And she puts a strap around him. She's 120 pounds. The guy is 200. She's going to hold him up. And they do one walk around the hall and back to bed. $217 charge. Oh, this one. Snake antivenom, rattlesnake antivenom. They've improved it recently, or not recently, some years ago. So there's very little allergic reaction to it. And you usually have multiple vials if you're really envenomated. And, you know, I think this kid had 15 or 18 vials over a period of 2 days. And that was the bill, primarily for the antivenom. Here, this one just blows me away. Now, I had a slide from Swedish. Again, people go to the press and get this information to them of a liter of saline, IV bag, you know. The charge for that was $440, and that was about 10 years ago. This one was more recent, and this was a guy hit his head, was concerned, went in to be checked, had a short visit in the ED. I don't even think he had a CAT scan or anything to look at his head. They said, you're okay, you can go home. This is the bill. This one, a lady who was transferred from one hospital to another. Somehow Medicaid, I don't know the details, Medicare didn't pay. I don't know if she had Medicare Advantage or what was going on. $82,000 for a helicopter ride. This one happened just last year. A child goes into the children's small hospital down south of Denver with some respiratory problems. The doctor see the child there and said, well, we need to get her transferred to the children's hospital in Aurora, which is like 20 miles away. Somehow, they decided, well, we'll use a helicopter rather than a ground ambulance. The helicopter bill for the 20 or 30 mile flight was $60,000. The insurance refused to pay it, said they should have gone by ground ambulance. People went to the press, and when you go to the press, that's one way to sort of get your insurance company to pay a bill. Why are helicopter rides so expensive? Well, 80% of medical helicopters are owned by private equity companies. And the private equity companies own the helicopters. Okay, and they decide on the charges for the flight, and they set most of the billing. The medical staff is from whatever hospital the helicopter is associated with. And they've just gone through the roof. Here's a lady who went into this is St. Anthony's North, was going to have some type of elective surgical procedure. She had insurance. She went in specifically to talk to the billing people. What's covered, what isn't covered, how much is it going to cost me out of pocket to have this surgery? She has the surgery and gets a $300,000 bill. And said, what's going on? This one, the hospital sent her to collections. She gets a lawyer. They take this all the way to the Colorado Supreme Court to get this bill and charge removed. Trauma center scams. Trauma centers charge an extra fee if we get notification that we have a seriously injured patient coming and we have to mobilize the entire trauma team, not just the emergency staff, but the surgeons and the blood bank and the respiratory therapist, and everybody comes down to meet the patient. Well, that jacks up the bill dramatically. And the HCA private for-profit hospitals figured that out very quickly. And they cash in on trauma centers. In Florida, they have most of the EDs. And they're either level 1 or level 2, so they can do these charges. And this is the blue lines on the top are the HCA price in these different states for trauma activation. And the gray lines are the average charges for the other hospitals. You can see how they dramatically increase the charges, but it gets worse. In Florida, 20% of people that get this big bill in the ED go home from the ED. They're not seriously injured. Somehow they get the big bill. Oh, this is another flagship case. Dr. William McGuire was I think a pulmonologist in Colorado Springs. He became the executive for United Healthcare Group, the original United Health Insurance Group out of Colorado Springs. He worked for them for 7 years. And during this time, United Healthcare started to become big. They started buying small insurance companies. And when he left the company in 2006, he got $1.6 billion. That was his go-away present. Somehow the Securities and Exchange Commission got involved, and they clawed back from him $620 million. So, I mean, the guy, he only got $1 billion out of this. This is a recent United Healthcare CEO, made $142 million in 1 year. This is money that should be going to patient care, but it's being sucked off of the system, going to these guys to pay themselves all this money. Here is the CEO compensation of a whole group of big hospitals. You can see it ranges from Common Spirit Health. Common Spirit is a hospital here now. St. Anthony's, I think. This guy got $32 million in compensation. Okay, and one of the others is 17. The poor people on this slide only got about 3 million a year. This is denying care. When they deny care, they get rich because they don't have to pay these big bills. And now they're using AI to deny the care, not even a real person. Oh, private equity, healthcare's vampire. The profit-obsessed monster is destroying not only just emergency care, they've been buying up anesthesia, critical care, hospitalists, all kinds of practices, particularly surgical practices like orthopedics, which are the high-paying specialties. And I talked about them a little bit earlier. Private equity's stealthy takeover of healthcare in multiple cities. They've not only taken over healthcare practices, they've bought up hospitals, particularly small rural hospitals, who are struggling, and then they run them into the ground even more, and they cause them to close, and they just leave. Ruining American healthcare. The only state in the country that's doing something about this is Minnesota. Minnesota has a law that won't allow for-profit entities like United Healthcare to buy up practices or hospitals. It's illegal. And they're going now after private equity in Minnesota right now in their legislature. Hopefully they'll do something about it. Some ER doctors are suing some of these companies. There's a big suit in California now that's ongoing. Hopefully they'll win it, but we'll see. And now we come to drug pharma abuse, outrageous and rampant. This is a flagship case where Martin Shkreli, this sleazy venture capitalist guy, bought the only small pharmaceutical company manufacturing a drug called Daraprim, which cost $13.50 a tablet, and overnight he upped the charge to $750. And this is a drug that people, particularly with HIV, who are immunocompromised, have to treat parasitic infections. And this is what he did because he could. The same thing with EpiPens. Remember, overnight they went up to $300. The lady who was the CEO of the company that did it was the daughter of one of the senators. And they drug her before the committee. That was kind of fun to watch. I forget which senator. This is the weight loss drug. These are charges per month. Okay? So this drug, I think you can now get it for about $1,000 a month here in the US. If you're in Great Britain, you get it for $90 a month. Why is that? Because Great Britain and many other countries like Canada, they have all the patients in one risk pool, in one insurance, and they can then go and negotiate with drug companies for prices. We just pay whatever they charge. This one, a new advanced treatment to basically cure people with hemophilia, which is a terrible disease. But look at the cost. That's for one patient. $3.5 million. This one, middlemen. This is pharmacy benefit managers. The three biggest pharmacy benefit manager companies are the health insurance companies, United Health, CVS and Aetna and Cigna. They're pharmacy benefit managers, so they're in the middle of this for profit. In fact, they're making more money off this than they are off of their private insurance. What are the impediments to healthcare reform? Well, special interest dollars. Boy, that's a big one. What many consider waste and abuse, like we're talking about here today, they just consider salary and profit. They make huge contributions to legislators. And of course, I don't know if we're ever going to get past this last one, unwillingness of legislators to work together for the public good. The red line is the medical industrial complex lobbying. compared to all the other special interests. You can see how much more money they're pouring in here. And here is back in, haven't checked it recently, this has gone up, but in 2020, contributions to our Senator Bennett in 1 year was $569,000 from pharma, $557,000 from health professionals, $245,000 from hospitals and nursing homes, for a grand total of $1.371 million. So you know why he's never signed on to support Medicare for all. There's been a bill in Congress for many years. Refuses to sign on to it. When there was a bill that would have allowed Colorado to import the same drugs we buy here from Canada, he refused to support it. So I wrote him a letter. I said, what's going on? Why do you refuse? He said, oh, we can't guarantee the quality of these drugs coming back from Canada. Well, here's why he refused. It's obvious. And he's up there screaming at everybody. He needs to start screaming about the waste and abuse in healthcare. Feds killed the plan to curb Medicare Advantage overbilling because of industry opposition. Oh, the place to go to get this information is a website called Open Secrets. That's a great website to kind of peruse. Open Secrets tells you what all the people in the country are paid by lobbyists and special interests. Open Secrets, this is the website. Reclaiming Medicare from corporate interests. There is a group called Take Medicine Back. They're organized. They're loaded for bear, of course, but they're up against this huge special interest money. And so we tried to fix everything the insurance companies allow, but still won't fly. What can be done now to control costs? Prohibit private equity ownership of medical practices. It can be done by legislators if they got but they're being paid off. Reinstitute, we didn't talk about this, a certificate of need. Some states, like Maryland, have if you want to build a new hospital, you got to apply to the state and you got to prove that there's a need for this new hospital in this area where you're building it. Most states, it's just the Wild West. You can build anything anywhere you want. Make all these charge masters where you get the prices public and have the hospital start justifying these outrageous charges. Make public the CEOs. There's no CEO of a hospital that's getting less than $1 million a year right now. Most of them are up to 10, 20 million. This one, allow Medicare can't negotiate prescription drug prices. They wrote that into the bill when they passed Part D, because the insurance company or the pharmaceutical companies basically wrote the bill. Now, Biden made a big deal out of, we can now negotiate for 10 drugs, 10 out of hundreds, and the negotiations don't even go into effect until 2026. And we got to reform those patent laws and prohibit direct marketing of drugs to consumers. That's a big one. That's a problem.